Overactive bladder refers to the condition in which patients experience urinary frequency, urgency, and urgent continence. These patients can have multiple trips to the bathroom to empty the bladder during the day and at night. They may also leak urine on way to the bathroom. 50 to 70% of women over the age of 60 have urinary incontinence. Our practice specializes in diagnosis and treatment of overactive bladder in women. In modern urogynecology, there are several conservative options to help women. There are multiple conservative and minimally invasive options to help women with overactive bladder. These include medications like Myrbetriq, which help relax the bladder. We can also do pelvic floor strengthening using pelvic floor rehab or emsella device to help strengthen the pelvic floor and help with overactive bladder symptoms. Emsella device is an FDA-approved chair which uses electromagnetic energy to strengthen the pelvic floor. Each session lasts 30 minutes and patients can get 2 sessions a week for 3 weeks. This device has been found to be extremely effective in patients with mild to moderate urinary incontinence. Patients may need one 30-minute booster session every 4 months to maintain effect. Percutaneous tibial nerve stimulation is another FDA-approved treatment to help patients with overactive bladder. It uses an acupuncture-like needle which is placed above the ankle. Stimulation of the needle for 30 minutes helps relax the bladder. The patients get a treatment every week for 12 weeks, and if it is effective, they get a treatment every month for 2 years. Bladder Botox injections can be a very effective form of treatment for women with overactive bladder. Botox injections can be given in the wall of the bladder to help relax the bladder muscle. These are extremely effective and the effect can last anywhere from 3 to 9 months. The patients have to be properly selected so that they are good candidates for this type of therapy. The procedure is done in the office under local anesthesia and takes 5 to 10 minutes. The procedure can be very effective even in older populations as it can decrease the need to take medications. Sacral neuromodulation is a very unique procedure which provides us an opportunity to test the S3 nerve which supplies the bladder. This procedure can be extremely effective in patients with urinary and fecal incontinence. Patients undergo a trial phase, which is like a test drive. A thin lead is placed into the S3 foramen through the skin. The patient comes to the office, lays on her back, and undergoes the procedure in an outpatient fashion. A thin lead is placed through both the S3 foramen to stimulate the sacral nerve. The leads are attached to an external stimulator and the patient observes the effect for a week. This procedure is called peripheral nerve evaluation and is done in an outpatient setting. The beauty of this procedure is that only if the patient has more than 50% improvement in her urinary or bowel symptoms, we proceed with placing a permanent battery in the lower back. This is a small battery which can last up to 15 years and can significantly help with urinary and fecal incontinence.